Hello and welcome. Today we'll be discussing a serious kidney disease called lead nephropathy. We'll explore what causes it, how it affects the kidneys, and what can be done about it. Lead nephropathy is a kidney disease caused by chronic exposure to lead. Lead, a naturally occurring heavy metal, can enter the body through various routes, including contaminated food, water, air, and occupational exposure. Historically, lead was used in many products, such as paints, gasoline, and plumbing. While regulations have reduced its use, exposure can still occur, particularly in older buildings and industrial settings. Children are especially vulnerable due to their developing bodies and tendency to put things in their mouths. Lead nephropathy develops through a complex cascade of events. Initially, lead accumulates in the kidneys, primarily in the proximal tubular cells. This accumulation disrupts normal kidney function in several ways. It can lead to tubular cell damage, causing impaired reabsorption of essential nutrients like glucose, amino acids, and phosphate. It also interferes with kidneys' ability to concentrate urine, leading to increased urine volume and electrolyte imbalances. Over time, chronic lead exposure can cause interstitial fibrosis, scarring of the kidney tissue, and ultimately, chronic kidney disease. Lead nephropathy affects people worldwide, although its prevalence varies depending on historical and ongoing lead exposure levels. It's more common in areas with a history of lead mining, smelting, or manufacturing. Certain occupations, such as construction workers, painters, battery manufacturers, and those involved in lead recycling, are at higher risk. Also, populations living in older housing with lead-based paint or plumbing are more susceptible. While regulations have reduced lead exposure in many developed countries, it remains a significant public health concern in developing nations. The signs and symptoms of lead nephropathy can be subtle, especially in the early stages. They may include fatigue, headache, abdominal pain, and decreased appetite. As the disease progresses, individuals may experience increased thirst and urination, anemia, gout and hypertension, or high blood pressure. Edema or swelling in the legs and ankles may also occur. In severe cases, lead nephropathy can lead to kidney failure, requiring dialysis or kidney transplantation. Diagnosing lead nephropathy involves a combination of tests and clinical evaluation. Blood lead levels are measured to assess recent exposure. However, because lead accumulates in bone over time, bone lead measurements can provide a better assessment of cumulative exposure. Kidney function tests, such as serum creatinine and blood urea nitrogen, are used to evaluate kidney function. A urinalysis can detect protein and other abnormalities in the urine. In some cases, a kidney biopsy may be necessary to confirm the diagnosis and assess the extent of kidney damage. Lead nephropathy is typically classified based on the severity of kidney damage and the presence of clinical manifestations. Stages of chronic kidney disease are used to classify the disease from stage 1, indicating minimal damage, to stage 5, indicating end-stage renal disease requiring dialysis or transplant. The treatment of lead nephropathy focuses on removing lead from the body and managing the associated kidney damage. Chelation therapy, using medications like EDT or Succimer, is used to bind to lead and promote its excretion in the urine. This is most effective when administered early in the course of the disease. Management also includes controlling blood pressure with medications, treating anemia with erythropoietin, stimulating agents, and managing electrolyte imbalances. In advanced cases of kidney failure, dialysis or kidney transplantation may be necessary. Prevention is key to avoiding lead nephropathy. This includes reducing lead exposure by testing your home for lead-based paint, using certified lead-free water filters, and avoiding occupational exposure. Workers in high-risk industries should use appropriate protective equipment, such as respirators and gloves. Pregnant women and children should be especially careful to avoid lead exposure, as lead can cross the placenta and affect fetal development. Regular blood lead level testing is recommended for individuals at high risk. The prognosis of lead nephropathy depends on the severity of kidney damage and the effectiveness of treatment. Early diagnosis and chelation therapy can slow the progression of the disease. However, chronic lead exposure can cause irreversible kidney damage. Recent research focuses on developing more effective chelation agents and exploring novel therapies to protect the kidneys from lead toxicity. Some studies are investigating the role of antioxidants and anti-inflammatory agents in mitigating kidney damage. While a cure for lead nephropathy is not yet available, ongoing research offers hope for improved treatment options in the future.